For the field as a whole, where is the field still behind when it comes to addressing drivers of burnout?
I think the biggest drivers are it's so different, right? Every single person has a different issue. And we have to really kind of categorize that as to factors that we can control within our workplace versus factors that we're enduring with our families, with at home. We're not separate entities, right? So there is that work-life balance and that often spills over. I think focusing on the things that you do have some control over. So specifically in my role for being well-being and within my department, I like to focus on things that are related to my work, right? Of course, emotional health is very important, but this is really hard to address throughout. So that's why I've chosen more ergonomics to focus on because that is a pain related entity that perhaps if we do address it, we can relieve ourselves and therefore allow for less burnout in that
And
sense. Mm-hmm.
yeah, and to piggyback off of what you said, it's also something you can control, right? There's a lot of factors we can't control in our lives. Ergonomics is definitely one of them. And what role does health system culture play in physician well-being compared to the individual habits that I just mentioned?
I think that is so important. It's very helpful to have a health system that believes in the culture of well-being. So, for example, at Michigan, we actually are fortunate enough where we have a chief well-being officer, and that addresses well-being across all the domains, along with our nurses and our support staff. And I think it's everyone's well-being that matters because when you're working on a team, it's really important to have those issues and have that open communication. If someone's not feeling well or not being at their best, it's really hard to promote positive culture. And so I think it's that collaborative spirit that's very important. And having a system that really emphasizes that is sort of key to counteracting or counterbalancing the lack of well-being that we sometimes are presented with.
What's one myth about burnout in ophthalmology that deserves to be busted?
I think one myth is that if we just go to read more books, or if we just meditate on our own time, that we will all be better. I'm not saying that meditation doesn't help, and I think it's a great practice, but to ignore the system factors and the lack of efficiencies across our systems that sort of keep the physicians there longer and keep the patients waiting are probably not a good sign to say this is how we're going to fix burnout.